9 minutes after. I think I'm on time. Our first presenter is Dr. Daniel Sanders. He is the innovative CEO of Ultra Oral, and he's going to give us a little presentation. So, take it away, Dr. Sanders.
Well, thank you very much for that very kind introduction, Matthew. We've gotten to know each other a little bit now in this last bit of time, and it's really a pleasure to be here. I think this is my first time I'll be speaking on the Dental Experts Network, and I thought that I would structure this different from the call that we had last, where I just sort of spoke, extemporaneously. I did prepare a little slide deck, and I think we're just going to run through the slide deck. And if you have questions, you know, I don't know, we're a little tight on time, I think so, but we'll see how it goes. We can take questions in the middle if necessary, and if not, we can do it at the end. So I think I'll share, and let me get that onto the full screen. Good. Can everybody see that?
Yes.
Yes.
Excellent. So the topic for today's call is empowering optimal health. And we're going to be talking about some basic concepts as far as how you absorb things into your body and some of the issues that you may or may not be aware of related to that. And then we're going to get into some of the technology that we're working on here in our R&D center to try to promote better health through actually better absorption. It's just sort of a opening slide. Just talks about when you mentioned the oral microbiome, one of my favorite topics, and the mature oral microbiome is got a lot of stuff in it. There's a whole huge number of microorganisms that are in there. A lot of them are actually what are called commensal. They're healthy, but there are some, particularly what are known as the orange complex and the red complex, which are actually quite pathogenic and specifically under certain conditions become more pathogenic. This slide just gives you an idea of like what the structure looks like if you look at it under a high power microscope. It's actually quite beautiful. It's not healthy for you sometimes, but it looks very nice. And what's interesting is that is a specific structure to the plaque. We used to call it always plaque. Now it's become oral microbiome film, but it's the same thing. And what's interesting is that there are certain late colonizers. It's sort of like stacks up. It builds itself like a sort of like a structure of building. And there are certain microorganisms, specifically one in particular, which we're going to focus on also later on. Some of the other slide is something called P. gingivalis, Porphyromonas gingivalis, which is considered to be one of the keystone pathogens that drives gum disease, periodontitis and periimplantitis. That's around dental implants. It's an anaerobe and it favors a low oxygen environment. And the structure of the microbiome allows that at the base of the structure, some of the other microorganisms create a situation which is low oxygen, and that favors these particular very pathogenic bacteria to thrive there and to be a driver in periodontitis and particularly in what's called chronic gum disease, which we're going to talk about. Shifting over, we're going to now talk about the main topic, and that is something called bioavailability. What is bioavailability? Bioavailability, as you can see here by the definition, is the ability of a substance to be absorbed, enter your bloodstream, and be used by the organs or the tissues or the cells of your body. And there's a couple of different ways you can put things into your body. So we're just going to go into some of the main ones. There's a couple more than that's on this list, but we're just going to talk about these for now, and in particular, two of them. You've got intravenous or intramuscular injection or subcutaneous injection, where you, in the clearest way, you inject something directly into your bloodstream. That's actually gives you 100% bioavailability. If you can get something directly into your bloodstream, then you're putting it directly into the circulatory system, and that's the highest level of bioavailability you can have. There's nasal inhalation, there's transdermal patches. There's parenteral oral, which is basically swallowing a pill or a capsule or a liquid, which is the most popular way of taking anything. Doesn't matter what it is, whether it's a nutritional supplement, nutraceutical, or uh, a pill, a drug. And then there's something which we're going to focus on more today, which is intraoral, and that's using actually the tissues inside your mouth, whether they're sublingual, which is under your tongue. It's just a Latin term for sublingual, under your tongue, or buccal, which is referring to your cheek, the inside of your cheek and the other tissues inside your mouth. Clear on that?
Yes.
Great. Okay, so let's just move that up. All right. There are certain factors that determine your bioavailability. In other words, you're going to take something, and the first one we just talked about in the previous slide, and that's route of administration. In other words, how you're going to put it in, how you're delivering it, whether you're swallowing it, whether you're injecting it, or in what we're going to talk about, whether you put it through the tissues inside your mouth. Next key determiner factor is whether the molecule itself, the substance itself that you're putting in, is it lipophilic or hydrophilic? Lipophilic means that it loves fats or that it is fat absorbable. Okay, it's absorbed through fatty tissue. Or hydrophilic, meaning that it loves water and is absorbed better in that way. We're going to talk about different ways of how you absorb things through the tissues of your body. Certain things go through a different route, depending on whether it's hydrophilic or whether it's lipophilic. Molecule size is really important. Okay, if you have a molecule and it's really small, in general, it's really easy to get it through. If the larger and larger the molecule gets, the more difficult it is to get something through, and that's what we've underlined there under passive absorption. In other words, if you're not doing something special to get it through the tissue and into your bloodstream, then the larger it is, the much more difficult it is to get it into the bloodstream and then into your body to have some kind of an impact, whether it's on disease or to improve health. And finally, we're going to talk about fluidity or permeability of the tissue membrane. And what that means basically is that the membrane is there as a barrier, and it's hard sometimes to get things through it. But if you can increase the temperature of the membrane, then you can make the membrane more fluid. And the membrane is a lipid bilayer, and by heating it up, you can make it more dynamic. You can loosen the structure, increases permeability, meaning ability to diffuse things through it. And that is considered one form of what's termed active absorption. So as opposed to passive absorption, where you just things sort of let things try to get their way through the membrane barrier, you are employing certain strategies and tactics to accelerate the process of absorption and therefore get a better effect. In this case, if you want to try to improve health, that can be very, very helpful and very useful. Move on to the next slide. Okay, a lot of people aren't aware of the fact that you take a supplement. Let's say you take a supplement and it's 100 milligrams, right? You take a pill, capsule, 100 milligram pill or capsule, you swallow it, it goes into your digestive tract. It's going to also, after it gets through the digestive tract and gets absorbed through the lining, it's going to be shunted to the liver, and it's going to also be metabolized or sometimes broken down in the liver itself as well. And what people don't realize is that you can take 100 milligrams, but you may only end up with 5 milligrams of what you originally put in.
Mhm.
Sometimes it's even worse. We're going to show you an example of some things that are worse. There's some things that are better, some things that are worse, but we're going to talk about that. So that means when you're swallowing something in general, not for everything, there are things that you can absorb well, and it's not a problem. You can do that through the stomach. But there's a bunch of things, particularly certain nutritional supplements, nutraceuticals that are important for health that have very poor bioavailability when you take them and swallow them as a pill or a capsule. Now we're going to discuss a route of administration, which I'm particularly partial to, and that is the oral cavity, the tissues inside your mouth. Why is that a good place to try to deliver things? Well, first of all, on the other side of the tissues, membranes, You've got a tremendous blood supply. It's extremely rich blood supply. A great example of how efficient and how significant that blood supply is that you can drink a hot cup of coffee uh, within 10, 20 seconds that you cool down that coffee. Just by it being in your mouth. And that's because all the blood vessels are pulling out all the heat really, really very efficiently. So there's a great example of the extent and the extensiveness of the blood supply that's right there on the other side of the membranes of the tissue in your mouth. What's also great is that you're completely circumventing what's called pre-systemic elimination, what we just talked about, the idea that things are going to get broken down in your gut, in your intestinal tract, and it bypasses the what's called first pass hepatic metabolism, which is the breakdown of metabolism that occurs to a lot of things, whether they're nutritional supplements or they're drugs in the liver by the liver enzymes. Additionally, there's a high safety involved here. People have, no, most people don't enjoy getting injections, and some people have difficulty swallowing certain things. Certain pills are large pills and issues. So if you can put it into the mouth and not have to deal with anything like that, it's a big advantage. But it's also a big challenge, and the challenge is the fact that that tissue, that barrier of tissue that's inside your mouth, operates under what's called slow passive diffusion or absorption, meaning that you put something in, it'll go through. Sometimes instead of losing 95%, you'll get 95% of it to go through, the opposite. But it can take hours for that to happen, which is not practical for most people, to put something in their mouth and leave it there for hours. So that's the challenge of how to use that particular route to deliver substances, whether they are nutritional supplements or drugs, into your body in an effective way. Okay, hold with me on this one. This is a little complicated, but not terribly complicated. Um, when something gets up to that membrane, it doesn't matter what the membrane, whether it's in the mouth or whether it's in the gut or any place in your body, there are two different ways in which it can get through the membrane tissue to the other side where the blood is, okay, where the blood supplies and the bloodstream is, okay? And that's what's called paracellular or transcellular absorption. What it basically means, if you can look at the little graphic that's on the right side of the screen there, you'll see that one over there is paracellular. That means between the cells. So if you're going to push things through, but not through the cell itself, but between the cells, because remember the membrane is made up of lots of cells packed one against the other, and there are little gaps between the cells, very small, but they're there. So you can push things paracellular between the cells. And it turns out that all compounds that are hydrophilic, that love water, prefer to go between the cells. Okay? And if you look at the right there a little further to the right, number 2 and 3 and 4 talks about different ways to do it, but that's transcellular. That means through the cell itself. You're going to push whatever it is you want through the cell itself. And it turns out that all lipophilic, fat-loving compounds will go through the cell. And why is that? Because the membrane itself is a lipid bilayer. It's mainly made of fat. So it likes things that are like itself, fat, and it will allow things that are like itself to go through it. And things that aren't like itself, which are water-loving things, hydrophilic things, can't get through through the cell membrane itself, through the cell itself. So they have to squeeze their way through that tight little spot between the cells and get in. Also important is to understand that, as we talked about, size of molecule is key for a lot of things. There's a big chart here. We're not going to go into it in great depth, but it just basically gives you a list here of some very popular nutritional supplements that are hydrophilic and ones that are lipophilic, and sort of what their function is in the body and what they do. It's not a full list of every single thing that each one of these does, but it just sort of gives you an idea that there are two main categories. There are water soluble and fat soluble nutritional supplements, and they will get through the membrane, as we just talked about, either between the cells, if they're hydrophilic, or lipophilic. They'll get through the cell membrane, through the cell itself of the membrane, if they are fat soluble, lipophilic. This is a cute little chart, little table here. Shows a couple of interesting nutraceuticals that when you swallow them as a capsule or pill, you pay a lot of money for these. These are not inexpensive supplements. Um, you think you're getting the whole thing. You're not even getting close to the whole thing. Uh, you're losing 92% of propolis. You're losing 90 or 99% of turmeric, which is curcumin. That's turmeric. Okay. Coenzyme Q10, you're losing more than 95%. Creatinine is anywhere from 50 to 80%. Inosine, it's 85%. Ashwagandha, you're losing more than 98%. B12 actually can be very well absorbed through the tissues of the mouth, but when you put it through your stomach, it actually maxes out at a very, very tiny dose and very, very poor absorption. And quercetin, which is a lovely a nutritional supplement, again, 98 to 99% of it you're not even getting. So you're buying these very expensive pills at your local pharmacy or nutritional supplement vitamin place, and you don't realize that almost all of it you're not actually getting into your body. It's actually flushing through your whole system, and you're getting no benefit from it pretty much compared to what you thought you were getting. We've been working here now on something very different. We have a patented technology delivery system that works on the idea of using a thermodynamic functional chewing gum as our vehicle to deliver whatever it is we want to deliver into the body. We use a very special gum base we get from a special European company. We've done a lot of research on that, and we're able to load our active ingredients up to 60% into the gum base. Most gums can only put 10 to 20% before they break down and they just fall apart on you. You can't chew it. So we're able to give dramatically more active ingredients into each piece of the gum. A lot of the advantages are self-evident. It's non-invasive. You don't have to. There are no needles. It's easy to use. It's very accessible, or we call, democratizing wellness. That concept that you can just take it wherever you want, on the go, at home, and it's highly efficient. We're going to talk about just how efficient it really is, and how it allows us to bypass all of the absorption inefficiencies that we just talked about. Okay, I'm going to go faster because I see I'm getting short on time here. So we'll skip over this slide, but everything in it is 100% certified organic, GMO-free, vegan, sugar-free, aspartame-free, and it works basically. You chew the gum, and the gum triggers a spontaneous chemical reaction, very completely safe. Materials, all FDA approved, and it allows us to heat up the gum and heat up the tissue that is coming in contact with while you're chewing it inside your mouth. And that rapidly allows us to absorb through the tissue and into the bloodstream what all the active ingredients that we've packed into each piece of the gum. And that gives us better health benefits. Okay. Junctional epithelium. We're going to just go real quick into this. We're going to fly through it. Around your tooth, there is a periodontal tissue, okay, which provides the last barrier to the bone, which is holding your teeth into your mouth, okay? And it turns out that tissue is highly permeable, very thin, and is very vulnerable. It's a vulnerable tissue. And in fact, we to mention at the beginning, P. gingivalis, it is a really nasty bacteria, and it has these vesicles, EVs, the extracellular vesicles that are filled with a lot of really bad virulence factors, particularly gingipains. And they've already found out that once that junctional epithelium has been compromised, the Porphyromonas gingivalis bacteria will get through there, translocate through the blood supply, for example, and go to all the different organs of your body and cause all kinds of problems. Right now, this particular slide is focused on cognitive health, and it goes right up to the blood-brain barrier, which normally can protect itself, but this particular pathogen knows how to actually uh, disable the blood-brain barrier and get its very highly toxic virulence factors into the brain. And they found that 96% of patients that have Alzheimer's disease have it in the brain and in their spinal column and the cerebral spinal fluid. And it turns out 2 out of 3 of Americans are going to experience by 70 years old some form of cognitive impairment, which can begin as early as 45. So that's one of them. This is another connection between oral health and brain health. Candida, C. albicans is another one that can get through the blood-brain barrier, translocates, and again, because of the chronic gum disease people have in the mouth, and gets right up to the brain and can cause problems with dementia. We've developed 2 products. First product is called Ultra Perio, and second product we call Sherpa. They use this technology that we have developed. Uh, the Ultra Perio is very specific and selective. Instead of killing like usually we take a mouthwash, doesn't matter what it is, whether it's all the big brand name ones or even the professional prescription ones like chlorhexidine, Perigord, et cetera. They kill everything. They just wipe everything out. And then you end up with a situation where after 24 hours, they all come back again. But the stronger bacteria are the more pathogenic ones. So you start skewing the mix of the bacteria in your mouth, and you get to what's called a more and more dysbiotic microflora that's in your mouth, and you're actually hurting yourself. Here, we're selectively going after just the bad bacteria and leaving the good bacteria okay, well, to be all right. And we also have other things in there that disrupt the inflammatory process because it turns out that a lot of disease, chronic disease, has a major component that is chronic inflammatory in its nature. So our general philosophy and my general philosophy is to try to go upstream, go take an upstream approach, go to the source of what may be a major driver in a lot of chronic infection and disease in the body. And it turns out that there are some very good targets to go at that are in your mouth. So that's it. I think we got through it pretty well.
Thank you, Dr. Sanders. That's fascinating. This is all, the oral microbiome is fascinating to me. I feel like we could probably spend hundreds of hours on all of this and still just probably get the tip of the iceberg. But thank you for that. And I'm excited about what you're working on. And I encourage people to reach out and connect and learn more. And one hope that I have as we continue to meet is to be able to